Good morning and welcome to NAMI New Jersey's webinar series. My name is Meredith Mason-Blount and I am the Executive Director of NAMI New Jersey. Today's topic is COVID-19 vaccine, all you wanted to know but hesitate to ask. Today's webinar is actually being brought to you by a partnership between NAMI New Jersey, Robert Wood Johnson University Hospital, and Rutgers Robert Wood Johnson Medical School. And we are very lucky to have with us today our presenter, Dr. Karen Lin. Dr. Lin is the Assistant Dean for Global Health, the Professor of Family Medicine and Community Health, the Director of the Center for Healthy Families and Cultural Diversity, and from Rutgers Robert Wood Johnson Medical School. We are very lucky to have you with us today, Dr. Lin, and thank you, and I'll turn it over to you now. Thank you so much.
Thank you. Thank you for inviting me. And like I mentioned to everyone that I've been giving the lecture starting from tasting how to do the test and now the vaccine. And every week the guideline change and the standard change. So I will be quick going through the things and then leave you time to ask questions. I personally also supervise our clinic for providing vaccines. So we encounter all different kinds of questions. So first of all, let's bring back why COVID is called COVID. So coronavirus actually exists for many years, even before 2019. In the past, it's just caused some wintertime fever, cough, sore throat, and it's not that serious. And many years ago, 2003, you probably heard about SARS, which is a severe acute respiratory syndrome. And at that time, 23 countries got affected. And there are more than 8,000 diagnoses and 700 plus deaths. And then in 2012, we heard about MERS, which is a Middle East Respiratory Syndrome. And it started in Arabian Peninsula, and there are 30% of death. In 2014, it actually found in United States. And then in 2019, there's this new coronavirus. So in December, WHO actually informed there's some cases in China. And then in January 7, last year was identified as a new type of coronavirus. And then January 21st, there's first case in United States. And then in February 3rd, there are 12 cases identified in United States. March 11th, that everyone was just not celebrating, but reminded that we actually have 1 full year of pandemic. And just to remind all of us, the coronavirus looks like that. They got a spike on the surface. It's called the spike protein. And then inside, there is their core, it's PCR. And so when someone got infected, would develop antibodies. And that's why when we are doing testing, we are actually doing these 3 things. The PCR testing to check for the genetic material. The antigen is to check the spike protein, and antibody to see if we develop anything can go against this virus. So I would like to invite all, remind you that whenever we have encounter with this virus, the first 5 days is almost like our incubation time. And then the next 5 days is what we call prodromal. And then the next 10 to 15 days, that's actually is acute situation. So if someone got tested within the first 5 days after the contact, the test may be negative, but already have virus inside of them. And the beginning, when we always mention about 14 days quarantine, is because after 14 days, if you don't develop any severe symptoms, then you are not going to make more virus in the body, and that can be controlled. So when we encounter with COVID-19, we can have no symptom at all, or we can have very mild symptom, just like a common cold. Or we have moderate symptoms, it's fever and chills and headache, runny nose, sore throat, muscle pain, and loss of taste or smells, diarrhea, and nausea. However, we can still handle that at home. We don't need to go to the hospital. Once it becomes very serious, like whenever there's a shortness of breath or high fever, then we advise patient to go to the hospital. And in the hospital, if they need oxygen or ventilator, then they will be in the ICU. And unfortunately, some people, they will proceed until like multiple organ failure. And last year, we have a lot more of the cases, but this year, I think we have better control of the situation. So now, a lot of people are asking about vaccines, that even our own colleague or our staff, not everyone is willing to get the vaccine. And that's the reason I want to talk to you, explain how vaccine come about. There are people asking about side effect, and there are people doubt if it's really work. Or some people say, well, it's just come out. I want to watch for 3-4 months to see how other people respond before I can get it. And they also are concerned about, is it safe? And how much does it cost? So let me explain how the vaccine come about. People may have hesitancy because, okay, last October, we start to hear about some companies making the vaccine, and they are vaccine clinical trial. And then quickly in December, their 2 vaccines got approved for emergency use. Let me explain that usually when a company develops vaccine, they have phases of clinical trial. Phase 1, phase 2, phase 3, and phase 4. Phase 1 usually is less than 100 volunteers. They are all healthy. And phase 2, there are several hundred of volunteers. And by phase 3, they have all more than 1,000 volunteers. And the researchers will try to answer those questions. And then phase 4, vaccine is approved. So for the general vaccine that you are used to, tetanus vaccine, or our children is getting the measles, mumps, rubella, or all those vaccines, childhood vaccine, they all finished the phase 4 clinical trial. And for this 3 vaccine now we have in the market, they are finished phase 3. So the first 2 vaccine got approved in December. The Pfizer's vaccine and Moderna vaccine is what we call the messenger RNA vaccine. So that this messenger RNA technique actually has been existing for decades. The way we make other vaccines is by that some of the flu vaccines, some of the other vaccines, we go by that. So you are not using killed vaccine or inactivated virus. It's just using the messenger. It's almost like when you are having your post office deliver a mail to your house and they put in your mailbox. They do not enter your house. And whatever is in the mailbox, then you take it in. And there's a viral vector vaccine, which is using benign or not violent virus. And then we make that into our body and kind of like fool our body's immune system and make them feel that the coronavirus is coming, so they geared up and develop all the resistance to go against this vaccine and develop antibodies. Once our body develop antibody, it will protect us from getting more illness when next time the virus hit us. And that's how when people actually got the COVID and they got sick, but they developed antibodies. And now that we want to provide vaccine for the people that they do not get COVID yet, but will help their body to develop antibody to protect them. So there are 3 different kinds of vaccine now available in United States: Pfizer's vaccine, and Moderna vaccine, and Janssen vaccine. Pfizer is for people 16 and older. Moderna and Janssen for people 18 and older. It's not because they cannot be used in younger people. It's because when they do their clinical trial, they want to get this fast. They only recruit adult patient and did not recruit younger children. And actually, both Pfizer and Moderna now they start to recruit people younger than 16 or younger than 18, the teenagers. And pretty much soon that we will see the vaccine available for this younger population. So Pfizer vaccine is 2 doses and 3 weeks apart. Moderna vaccine is 2 doses, 4 weeks apart. And Janssen vaccine is 1 single dose. The dosage is all very small. It's Pfizer's is 0.3 cc, and Moderna and Janssen is 0.5 cc. And so they all come with different vials. Obviously, for Pfizer's, it's 5 doses per vial. The Janssen is also 5 doses per vial. And then Moderna has 10 doses per vial. Nowadays, people are recommending to see if they actually can come up with the single dose vial. And then you also heard that for Pfizer vaccine, they really have to be kept in extremely cold freezer. It's minus 80 Celsius, and it's almost like a minus 74 Fahrenheit. For Moderna vaccine, we can keep them in the regular freezer that right now we are keeping with all other vaccines. The tetanus vaccine, the flu vaccine, the pneumonia vaccine, they all are kept in, stored in the 36 to 46 Fahrenheit. And Janssen vaccine it also can be stored in the regular freezer for our vaccines. The Pfizer and Moderna is to check for the messenger RNA. And Janssen vaccine is made from modified adenovirus. Adenovirus is a very common virus, again, that existing and may cause a little bit cold symptoms. So using that modified adenovirus as vector to bring the spike protein into the body and have body's immune system start to manufacture the antibodies. So the Pfizer's vaccine was approved on December 11th, and Moderna is 1 week later. Janssen was approved in February of this year. And if you want to see how many people are enrolled, Pfizer's and Moderna, they are all involved for more than 30,000 people. And they have, Pfizer have 150 clinical sites, and 39 is in United States, others in other countries. The Moderna has 89 clinical sites, 32 is in United States. And then there's the racial breakdown. Some people ask me, oh, is this vaccine better for this particular ethnic group or not? It's actually not so, because it depends on when they recruit volunteers. Not too many volunteers in specific group will come, and that's why this is a data. For example, for Pfizer's vaccine, there's 1% of Native American volunteers got recruited. Doesn't mean that it's less effective. It's just when they do the recruitment, less people recruit from that. And then and so for Janssen vaccine, they also enrolled 43,000. And this Janssen, actually, the research site is right here in New Brunswick, and Rutgers University actually is partnered with Johnson & Johnson to do this clinical trial. And they have like 8 countries. And again, the breakdown of the racial distribution, you can see is still white and Hispanic is more. And then American Indians or Asian are less. And this is a test on people age 18 to 100 years old. So where can you get vaccines? In the very beginning in December, only the hospital and a long-term care facility and federal qualified health center can get them. And now that we have expanded every week, there are more places come. For example, near here, there's an Edison mega site that the mega site can give out 3,000 vaccines per day. And in our federal qualified health center, the most we can give out is maybe 184 per day. So because our center, we still need to have regular business going on for patient care. And the mega center, all they do is just to give you vaccines. And also the pharmacies, CVS, Walgreens, Rite Aid, and ShopRite Pharmacy now all have vaccines. So this is the picture of a mega site. So there are mega sites in Bergen County, Morris County, Middlesex County, Burlington County, Rutgers, and Atlantic County. Once people get a vaccine, they will get this vaccination record card. We'll record the lot number and what's the date they got this vaccine. And this is very important to keep because nowadays when you travel certain countries, they might want to see the vaccine card. So to talk about messenger RNA, some people that have concern, well, is it going to affect fertility? Is it going to affect my own DNA or my own gene? No, it's not, because the vaccine, it does not affect our DNA, does not affect our genetics, and that does not enter the cells, the middle part of the nucleus. And it's only get into our body and then they just disintegrate it. And so we use this technique to do the influenza vaccine, Zika vaccine, rabies vaccine, CMV vaccine. So this technique has been in research for many, many years. So before we give people vaccine, that we definitely ask them all those questions. And even for people they register with the state, those questions are already asked. We just double check. So if someone feels sick today, this morning had fever, we definitely don't want to give them vaccine today. And we also ask if they ever receive COVID vaccine. We do not recommend to use different brands. Someone has Moderna for first dose, we recommend to have Moderna for second dose. There's no data to show that if the first is Pfizer, second is Moderna, does it work or not? There's no data available. And for people that are allergic to PEG, because in order to make this messenger RNA, it's this messenger RNA is wrapped around a fat thing. And then in order to make that, there's a component that you usually will see that in Muralax, which is a laxative. So if people are allergic to that, we recommend them to use other vaccine, not this vaccine. Or some people, they have a dermal fillings, they go to the plastic surgeon and have certain kind of injection. And if they are allergic to that, then we try to find other alternatives. If someone ever have really quick allergic type of reaction, what we call anaphylaxis reaction with other vaccine, then we like to know. Anaphylaxis means like all of a sudden they just develop shortness of breath, they feel their throat is closing and their whole face swells up. However, every vaccine site have something called EpiPen. So when people have that with bee sting or something, we give them instant injection and release those the symptoms. And we also don't want people to have other vaccine within 14 days. For example, if someone just had shingles vaccine or just had a pneumonia vaccine, we would like them to wait for 14 days before they get a COVID vaccine. If someone, they test positive for COVID, then that means they may get infected, and then their body may develop the antibody themselves. So we also ask them to wait for at least 3 months. And if someone going to the emergency room and emergency room doctor find out they have COVID infection, give them something called monoclonal antibody infusion. Then if they already have that, means they have developed some antibody and they don't need the vaccine at this moment. If someone have bleeding disorders, that means they have low platelet or some kind of clotting problem, we would like to know before we even give vaccine. Someone have an immunocompromise, for example, if they have HIV or cancer, we will let the people know that because they are immunocompromised, their defending system is weaker than normal people. So if normal people after vaccine will develop, let's say 100 copies of antibody, then this population immunocompromised may develop much less antibody to protect them. And if someone, they are pregnant or breastfeeding, we like to also advise them, doesn't mean they cannot take it, they can still take it, but we will let them know this is safe when they are pregnant or breastfeeding. And so, for example, this is one of a Moderna, and we will drop in the syringe and they are good for 6 hours. And then usually we put them in the upper arm. There are possible reactions after vaccination. Most of the time, it's the injection site that the next day may develop a little bit redness or a little bit tender when you touch it, but usually will disappear after 2 days. And sometimes some people will develop really tired or sometimes have headache, muscle pain, and some joint pain that also happen. Then we ask them they can take a Tylenol and not ibuprofen, because ibuprofen or Advil, they are what we call anti-inflammatory medication, and we actually want our body to have the reaction. So you can take a Tylenol for the headache, for the fever, but not to block the defense mechanism. There is really remote chance that some vaccine may cause more severe allergic reaction. So whenever, if there's like a swelling of the face or throat or difficulty breathing or fast heartbeat or feel dizzy, we would give advice. So everybody after the vaccination, we keep them aside for 15 minutes for observation. For people that have the history of some kind of reaction to some kind of antibiotics in the past or some kind of unexplained situation, we'll keep them for 30 minutes and to observe them. So like I say, that every week we would receive some kind of report. So this is from last week. There are few of blood clot event with Janssen vaccine, and there are some a blood vessel problem with AstraZeneca vaccine. AstraZeneca vaccine is not available in United States. Right now, it's more available in Europe. There are, so people are, but this is like a really rare minority for the vaccine. And unfortunately, we really don't have the prediction who is going to get this kind of reaction. But if we compare the risk and benefit when someone gets infection of COVID, and they are much more severe and could be life-threatening versus if someone get a little bit side effect, and we still recommend to get the vaccine. After the vaccine, right there on the site, we help everyone to get into vsafecdc.gov right on their cell phone, that they will send the client text message every day for 7 days, just to check to see if they develop any kind of side effect, the fever, headache, or chills or dizziness. And then after a week, they are going to text you once a week for a month, and then will be once a month. So they will continue follow. Remember, all this vaccine right now is under emergency use authorization. And so CDC would like to continue follow to complete the phase 4 type of almost like a clinical trial. And then there's a special website that the doctor or the client themselves can go on and to report any kind of adverse event. So this is the statistics up to yesterday, because every time after the vaccine, we all have to enter the state website. So state know exactly how many people total vaccine administered. So this is a New Jersey data up to yesterday, that there are 5 million people plus got administered. And then people with at least one vaccine is more than 3 million. And 2 million people actually got fully vaccinated. That means it's a Pfizer or Moderna, they got their 2 doses. Or if the Janssen got their 1 dose. And so from that, you can see that female, probably 56%, and males 44% among those 5 million. And if we categorize by the race and ethnicity, mostly is white race, like 57% received the vaccine, and Asian and Black and Latino population, they're still less than 10%. And that's the part we really need to give more education, because apparently there are more people that have hesitation. Another thing is they also have limited access to the computer that I will share with you. There is computer they can website, but for people, they don't use computer, it will be very difficult for them to register for vaccine opportunities. And then there's a phone numbers. So later on, I have a slide with all those necessary phone numbers. If you happen to know your friends or your elderly grandparents, they have problem, then you certainly can help them. In New Brunswick, we also help some people that, for example, the homeless population or some church group, they are people, they just cannot navigate this website themselves. Then we have medical students help them to register. And then by the age group, as you can see that up to this point, age 50 to 64 has like 29% received the vaccine. And obviously that more than 80 years old, if they are in the nursing home setting, then actually the Walgreens and CVS are giving the permission to enter the nursing home to give them vaccine. So if there is your neighbor, they are in 90-year-old and live in the community, they have more difficult to register. Those are the people we need to help them. And at this point, that in New Jersey, we give out more Pfizer's vaccine, and Moderna is about 40% and Janssen's 4%. That's sometimes patient will ask me, do I have a choice? To tell you the truth, that each vaccine site, they are giving the vaccine, it's by either state government or federal government. So we do not have a choice that, oh, I want this vaccine or that vaccine. We'll be happy if anybody have eligible for the vaccine. So obviously that once people got vaccine, they feel it's safe to travel. And the CDC also modified their guidelines that if they already fully vaccinated and they travel domestically, then there's not required to self-quarantine after their trip. This is just domestic. But if they do international travel, it's different guidelines because the other country, they may have different guidelines. Unvaccinated travelers should still do self-quarantine if arriving in New Jersey from beyond the immediate region. So for example, we have during the spring break, lots of students went to Florida for their spring break and then come back in New Jersey. Then those people need self-quarantined because we have not been giving the vaccine to people younger than 20 years old. By April 19, next week, it will be open to the people 18 and over. So in the beginning, that is very restricted because we do not have enough supply by December or early January. So the vaccine we can only give to healthcare personnel and the long-term care facility resident. And then, as you can see, when I prepare this slide each month, in February, we open to 1B and 1C. So for example, the frontline essential workers, it's including the police officers, firefighters, correction officers. Is no longer just the people they work in the hospital or in doctor's office. And then at first, it's over the age of 75, and then it's over the age of 65, and currently over the age of 55. And as I mentioned, that next week we will be open even to the younger people. March 5th, that also expanded to the paid or unpaid healthcare workers. So they are volunteers in the soup kitchen or in the food pantry. They can be vaccinated. First responders, including the law enforcement people or pre-K to 12 educators or staff, because in preparing for the student to return to school, we certainly want all their teachers got vaccinated. And so we've been very consciously provide vaccine to the public school in New Brunswick, and every township has been doing that, and also expand to child care workers. March 15, expand more to the public safety workers, the migrant farm workers, member of tribal community, and March 29th, it's expand to more. And now that April 5th, that expand to anybody over the age of 16 with developmental disabilities, they are eligible. Communication, IT, or media workers all have that. And even the laundry service worker, librarian, real estate agents, utility workers. And next week, all age over the 16 will be eligible. So if they are eligible, how can you help people around you to get registered with the state? So this slide is probably the one you want to keep with you. First, if you want to know anything about COVID-19, there's a covid19.nj.gov. Obviously, you can go on to CDC website, but there are a lot more information. And if you think that the New Jersey information is more relevant to you, then just go to covid19.nj.gov. The second website is if you are still need to have testing. And in fact, people are more used to it now. Before any kind of procedure, colonoscopy or eye exam or a dental exam, your doctor may require you to have COVID testing. And then it's not just at your doctor's office, that a lot of pharmacy also offer that. And actually they are making some home kits now. It's not totally available yet, but in other countries, for example, in Germany, that they can just purchase those, and then before people want to get together, and they can all test themselves at home and make sure that it's negative before they get together. And then to register for the vaccine, you can help people to go on covidvaccine.nj.gov and then answer all those questions, and then will be on the state website, and the email will contact you by email and say, okay, you are eligible, and you can pick the site. There is also that some for example, ShopRite or Walgreens, they don't necessarily register with the state. So you can actually go on to that called the finders directly with the vaccine site. And so those places, and then if people, they don't have a computer, then look at the bottom, there are 3 numbers. The first number is for regular people, is from 8 a.m. to 8 p.m. On the weekdays, is a vaccine appointment support. And now they have a designated senior helpline. This one is for designated to all the seniors, because at this point, anybody over the age of 65, they should have been getting the vaccine already. And if they are not, then this a special phone line they can call. And then this number is 24/7 when there's any medically related questions. So even after the vaccine, please still remember 3 W's: to wear the mask, to wait for 6 feet, and to wash the hands. Why is that? The vaccine does not prevent us from getting the coronavirus. It will prevent us to get sick if we actually encounter the coronavirus. And so people can still carry the virus, and they can still spread to you, or even you had vaccine and you have encountered, you may carry the vaccine to other people. So please still observe this. I just have other information about the testing if someone still need, but right now for testing, it's much easier. So now the cost, because this comes from the federal government and everyone is free to receive it. If you have medical insurance, they will get your insurance information and charge to insurance company. If you don't have insurance, the policy for New Jersey is if you live here, if you work here, if you study here, you can get vaccine free. I'm going to open for the questions and stop sharing.
Wonderful. Thank you so much, Dr. Lin, for that for the great presentation with a lot of great information. As we know, we do have a lot of questions, so I'll just go ahead and get started. So the first question is, Does the body get confused or strained from having so many vaccines go through the body? So for example, you said you have vaccines when you're younger, the flu shot, and now this vaccine. Should people be worried about the number of vaccines they need over their lifetime?
No, because every vaccine is specific. And so they develop antibodies specific to specific things. And so when we are young, there is a vaccine for meningitis, there's a vaccine for hepatitis B, and that's specifically just for that. And there is no cross reaction to that.
Great, thank you. And so regards to some of your comments about waiting for the vaccine, if someone gets the vaccine now and then there's improvements to the vaccine later, will the people who got this initial vaccine be negatively affected, or will it continue to do what it's supposed to do?
So the question is, at this moment, when we give you vaccine, we don't know how long the antibody will last. We learn from people, they get the illness, that the antibody exists beyond 3 months. And we hope the vaccine that you get here, the antibody developed, will help you for a minimum of a year. But we also learn from flu vaccine. Remember, we need to get flu vaccine every year because the variant comes so frequently. And so this year's vaccine is made from last year's and may not. So at this moment, we don't know if we need to revaccinate everyone next year. We just have to wait and see. And we also don't recommend people go to the lab and say, okay, check to see if I develop vaccine or not. It's not recommended. We
Okay,
obviously that, right now the 3 vaccine, even we say, okay, Janssen vaccine, because it's 1 dose and maybe has a 66% efficacy, and Pfizer has 94%, and the Moderna has 94% or 93%. That's just means that when you have 100 people all encounter with COVID, and how many people will be protected from getting really ill sickness.
Thank you. So we do have a few questions about that. So you just answered it, which is we are not sure how long the vaccine will last. There might be boosters in the future, but we're not sure right now.
Exactly. Just like a pneumonia shot in the past, when it first came out, we thought, okay, you just need 1 dose lifetime. And then later on that we learn, okay, you actually need 2 doses. Or so we just have to wait and see.
Great. If someone already had COVID, how long do they need to wait to take the vaccine?
Okay, so it's interesting, in January, when we have a limited amount of vaccine that time, that we usually tell people to wait for 3 months. So other people, because they already have some protection. So we want other people without protection to get it. And with this president and administration, we actually got a lot more vaccines. So at this moment, we ask them to wait for maybe 2 weeks before they can get it. And in fact, a lot of things you probably hear about 2 weeks. If someone just got the shingles shot, then wait for 2 weeks to get this shot. If someone just got tetanus shot, wait for 2 weeks to get this shot. If someone is ill 2 weeks ago, that hopefully now it's better, there's no fever. Obviously, we don't want to give vaccine to anybody with fever with any vaccine. So if someone still has fever, we don't give vaccine.
Thank you. So if someone has had an anaphylactic reaction to other things, not to a vaccine, like to food or something, should they wait to get the vaccine?
No. So when we know about this history, we, like I explained, every site have EpiPen next to us. And then we just observe this person 30 minutes instead of 15 minutes and see if there is any reaction. So if there is anything reaction developed 24 hours later, then chances are it's not due to this. So if you have food allergy or antibiotics or allergy or bee sting allergy or something, you don't have to wait. You just need to let the people know. And obviously, you can also first discuss with your primary care doctor, because your primary care doctor knows you well. And if your doctor say you are okay, then you are okay. But I also heard that some OBGYN told their patient, oh, because they are pregnant or they are breastfeeding, they should not get vaccine, which is not correct. And you can check on CDC, because as more data coming out that now we have the volunteer, they are pregnant and they are getting that and they don't have problem. And
Great,
that's
thank
why
you so
I
much.
suggest COVID-19.nj.gov. Usually they will pull some important information from CDC, or you can just serve the CDC. And CDC actually have different language too, but at this moment they only have 6 languages. And so if you feel more comfortable to serve that, by all means, check that.
Great, thank you. Now, you said we should use Tylenol, not Advil, after the shot. What should people take if they are allergic to Tylenol?
Well, then probably, so if someone has really uncomfortable high fever, which is very unlikely, for example, if their temperature is over 102.5, then to take one Advil or ibuprofen probably not going to hurt them. Okay. If they are allergic to Tylenol, then some cold towel or something, and rest is the best. Don't just, some people ask me, so can I go to gym now? I usually tell them, okay, just relax for 2 days. You can skip that. Don't exert yourself right after the vaccination.
Great. And how soon after the vaccine can people start taking the Tylenol?
Oh, so like I say, usually that within a couple of hours, they're not going to feel anything. Most of the time it's the next day. And so they certainly can start to take if they have fever or body ache. For example, like a messenger RNA type of vaccine, which is Moderna and Pfizer, they are wrapped around in a oil. And so when they are sitting there, they need to break open and have that messenger come out. So it's not going to be there within an hour. So most of the time, it's the next day people feel some tenderness or a little bit red around that area.
That's a great explanation. Thank you. So there are also reports of a number of variants and strains of the virus, European, African, Brazilian. How do we know, and does this current vaccine package, these 3 vaccines, protect against these new variants and strains?
Yes, this is a very hot topic, and every week that those 3 companies, obviously they are checking at that. And then we also know that it's already variants, it's already in New Jersey. And so obviously, if you want to travel to other country, and that's why you need to be careful. As far as can they protect through that, at this moment, we were told that the data show that Pfizer and Moderna may have a little bit more protection against the variants because they actually have 2 doses. And when you have 2 doses, it's a booster. Booster means you make a lot more antibody than Janssen. And that's why, in Africa, I think now Janssen has more difficulty to go against the variant. And again, that even Janssen right now say 1 dose is enough. I don't know in the future. We really cannot predict. We go by what scientists or researcher told us. And as far as, and that's why I still recommend, we still all recommend you still do 3 Ws. Wear the mask, wait for 6 feet. Although now in school, they say in the school, they can probably 3 feet for children. But if you have a gathering, I certainly don't recommend you to go to bar, and even the bar right now is not in full capacity, but every place is open a little bit still with a restriction. You never know the people next to you if they actually have variant, but be conscious when someone, they just come off the airplane, they can be exposed to different kind of stuff. But if your household, so some people ask me, so now in my household, when we are together in the dinner table, should we still wear the mask? Obviously, when you are eating, you don't have to do that, but depends on your family member. If they are working in the setting that Walmart or something, they're still exposed to other people, just be careful when they enter the house. For example, we do the clean, wash our hands before we expose to other family member, we still need to do so. Just be conscious. And the more difficult thing is for the college student. So now that Rutgers president has said everybody return to September campus, they all have to finish their vaccine. So we will see, because for the whole past year, we don't see much of the student on campus. And now when the college student come to campus, they are not as compliant as the school children. We have to see. And the fact that we have the search for the younger population during their spring break, we know. And you see the TV news, what happened in Miami, everybody just crowd together. So
along those lines, how long should someone quarantine after an international travel?
At this point, it's, we usually just say 11 to 14 days, but also depends on that countries. So when we go out, different countries have different restrictions. And some country, they even say that if you are not taking our vaccine, we don't recognize that. You still need to quarantine. For example, someone traveled to China, they still need to quarantine for 14 days, even they receive the vaccine from United States. And vice versa. Our Rutgers University has said, well, if you did not receive the vaccine we recommended, then we'll be happy to give you once you arrive on campus. So people may receive different kind of vaccine. So this is a time that we really need to review all the travel guidelines.
So we have, just as you know, there's same questions kind of coming up. And so some of these might be repeated, but just to make sure everyone hears the information. Individuals who have insurance are still not being charged for the vaccination, correct?
They are not being charged. They will charge the insurance company, not to the patient. Yeah.
Great. Does the mRNA affect fertility at all?
No, not at all.
Do you know of any adverse interactions with other families of medication? So if someone is on a regular medication, they should just talk to their doctor about the vaccine?
Yes. At this moment, we don't, for example, the general medication for diabetes or high blood pressure or those, there is no interaction. The one I mentioned is probably like, there's specific component that we don't even know them. For example, inside of a Muralax, when people, they have a constipation and they take that, and obviously it make them go. So that means there's some, so if they have that, they just need to talk to their doctors. And also all the site will give you component of the messenger RNA, the Pfizer's, or they all have their inactive ingredient all listed.
Great, thank you. And we have some questions about people who are vaccinated and not vaccinated. So for example, is people who are vaccinated, should they mingle with non-vaccinated individuals? And in a household, if one person is vaccinated, should the rest of the people get vaccinated as well? And does the vaccinated person pose a danger to those who are not vaccinated?
Vaccinated person do not pose danger. vaccinated person, their body develop antibody, and the antibody actually will protect them from getting sick. They do not spread. This is not, we do not give them a COVID vaccine, we do not give them a virus into them. So they do not carry that to give to other people. And obviously in the same household, depends on different phase up to this point. Obviously, if someone is working on the health field, they already got vaccinated. And we all do. For example, like my husband, I got vaccinated and he didn't, then I have to be careful. Or if I have an elderly, they are 80 years old, already got the vaccine, and I did not, I have to be careful. So when we say careful, wash hands, wear the mask, and keep 6 feet. It's the same guideline.
Great, and I think that answers our next question, which is that someone read that vaccinated people do not spread COVID if they are exposed to the virus. But you just said that, until you are vaccinated, you are still susceptible. So still wash hands, 6 feet, and take precautions.
Yes, we should do that. So I should say the vaccine we give to your arm, that thing, you are not going to spread to your family member. However, you can still go to a store and the virus happen to stick to you, and then you can carry that virus to other people. You may not get sick. The other person, they are not vaccinated, may get sick. And that's why we still need to keep our distance. We still don't hug people. We still use elbow greeting, because I would not get virus from the vaccine, but I may carry. For example, if I work in the hospital, I still change into the scrub, and then before I leave the hospital, I change it back to the thing, and then I go home. The first thing I do is I take shower. I don't want to carry anything to my family.
Thank you so much. So thank you everyone for all of your questions. And I think that was a great point to end on, Dr. Lin, which is these vaccines do not have the coronavirus in it, correct?
No coronavirus in it. The first 2 vaccines is just messenger RNA. And then the Janssen vaccine has adenovirus, not coronavirus.
Great. Thank you so much. Dr. Lin, this has been an amazing, amazing webinar. Really, thank you so much for sharing your expertise with us and just taking the time to answer all these many, many questions. We really appreciate it. Thank you so much.
Sure. Thank you for inviting me.
Absolutely. And this slide with all this information will be put up on NAMI New Jersey's website as well. So what I'll do is I'll just share my screen really quickly. Just so you can see where to, after this webinar, you can find it. If you look at this is our website, naminj.org. If you go to programs, there's COVID-19 support and resources. Click on that page, as my internet is slow, and you'll pop up our COVID-19 page. And this is where you can find a whole sorts of information about hotlines, and we will put Dr. Lin's that slide right there so you can find where to register, who to call, and those types of information. Again, thank you so much, Dr. Lin. And again, I'd like to thank Robert Wood Johnson University Hospital and Rutgers Robert Wood Medical School for partnering with NAMI New Jersey to bring us this webinar today. Thank you so much for joining us. And as a reminder, you will get an email with a survey to take after this webinar. So thank you so much. Thank you, Dr. Lin, and thank you everyone. Stay safe and we'll see you soon. Take care.